Hi there, how are you? This is Lois. Welcome back to my channel. Today I want to talk about healthcare aid jobs when you come abroad. And in this regard, I'm just going to talk about Canada because that is what I have experience in. I don't know about other countries abroad, but I think they could be similar to what we have here in Canada. And when I talk about healthcare jobs, for the purpose of this video, I'm not talking about doctors, about nurses. I'm not talking about those kind of jobs. I'm talking about health aid care jobs. There's a lot of misconception, especially when you're out there in Africa, when you're out there in Kenya in specific, because I've been there, and people talk as if they have very low regard of immigrants who come here and do healthcare work. And when I say healthcare work, I'm talking about the healthcare aid or the nurse aid jobs as they are called. These are more like the caregiver jobs. And in this case, when I say caregiver, I'm not talking about nannies. It's the caregiver jobs in the health care sector. People will tell you, oh, you know what, I would never leave my country. I cannot go clean people, clean old people, deal with a lot of, there's a lot of talk about the things people think people do when they come here as immigrants to work in the healthcare business as caregivers. So where do I start? When we talk about caregivers here, we are talking about very rewarding careers. And these careers are not just for immigrants. These are careers for everybody here. So the stereotype that the only people who do these jobs are immigrants, that is first big lie. Yeah, so it's everybody. There are people who are born in this country, there are people who come from everywhere, and they do these kind of jobs. And when I talk about these kind of jobs, when I say they do these kind of jobs, this is taking care of all the elderly in nursing homes, taking care of people with disabilities, maybe in group homes, in the community. So these are the kind of jobs that I'm talking about. Being a social worker, being a community worker, support worker, living support workers, all those people, the health aid care workers, all those fall in that category. So yes, I said these are real jobs, they are rewarding jobs, and they are not just for the people, they're not just for immigrants. These are jobs for everybody. Okay? The thing is, when you're new here and you're trying maybe to establish yourself, what you're going to find is that these are some of the easily accessible jobs. Like these are jobs that you can find easily, quite easily. If maybe you have an experience, maybe you volunteered somewhere, with people with disabilities where you came from, this is a very easy field to get into, regardless of your profession, regardless of what you do there. And so it's easier then to get. If you don't have any background in nursing or taking care of anybody, there are some courses that you can do, really quick courses, about 6 months. You can do them. They are cheap courses, they are readily available. You can do those ones, and once you do those courses, you can get a job. So assuming you came here, you are a nurse, before you get your license to practice, this is a job that a lot of people use as a stepping stone. Yes. So you can always get this kind of a job. You work while you're working on your goals, on your career goals. Okay? Yes. So what are the advantages of these jobs? First, they are easily accessible. They are very easy. People are always hiring. Agencies are always hiring. The other advantage is that they have great pay. And like the store jobs, whereby most of the people earn minimum wage, these jobs mostly pay maybe between $18 an hour could be up to $25 an hour. Come on, that is good money. And some agencies do offer bonuses. The other advantage is these jobs offer flexible shifts. So assume you just got here, you don't have daycare, you don't know, you're still trying to figure out, you're looking for a job. You can always concentrate on looking for a job maybe during the day, and you take up this kind of a job in the evening or when your shift allows. Or maybe you're here as a couple, you have young children and you're trying to settle down. One of you can take this kind of a job. Maybe you work this kind of hours and the other person works the other shift, just so that then you can take care of your children. You can drop your kids where they need to be dropped. Then another advantage is this job usually is not physically demanding. And when I say that depends, because maybe you're working with someone who is on a wheelchair, so that could be a little demanding, but it's not as in heavy lifting. You're not doing the heavy lifting with your hands. There are machines, so it's not like you're doing everything by hand. No, but then again, there's some physical demand that could arise depending on the client that you are working with. Again, these kind of jobs, what you find is they have great overtime pay, and that means maybe you're working over weekends. There could be a shift differential. That means the people who work during the day, maybe they don't earn as much money as the people who work overnight. Then you can also choose the level of complexity. If you're not confident working with someone with complex needs, you can always work with you can choose the kind of a client you want to work with depending on what you're comfortable with. Okay. Then, as I said, these are jobs because you can choose your shift. There's a lot of people actually who do day jobs in offices, and they moonlight at these jobs because then that is an extra pay. And the beauty that I see in these jobs, there's some jobs actually called overnight. It could be awake overnight, or there's some jobs whereby you can go and sleep at a client's house. As long as you're giving them companionship, you could be allowed to sleep at certain hours of the night. So as you see, you can work during the day. Assume you don't have a family, you're all alone here. You can make good money. You can make good money by your day job and then still make some good money in the evening when you're doing this. You can also work in group homes, and in group homes, usually these are homes owned by agencies, and there you're working maybe 2, 3, 4, 5 people in a group home. So there's always that sense of community. You have colleagues, you're working together. It's not so much that you're doing in a group home, apart maybe you may need to stay awake overnight if you're working overnight. Okay. So these are kind of jobs that you can take up. You can work during the day, you can go to school, you can do a lot of other things, so you can develop yourself. I know people who do this kind of job, 2 years you're doing it, and in 2 years time they are graduating as nurses, like either licensed practitioners, LPNs, or registered nurses. You can even do a degree course while you're still doing this kind of a job. A lot of people also who do this kind of a job, because mostly it's about the social part. It's people who want to do psychology or social work. So you can do this job, whatever shift you want, and during school doing your degree in social work or degree in social psychology, whatever you want to do. So they are really great and rewarding careers. I said that you can always do a course. If you don't have the background, you can do a quick course, and they are easily available in the community colleges, and those courses go for about 6 months. The disadvantages, there's always going to be disadvantages of something. Is what I find, especially for new immigrants, because these jobs pay more money than the minimum wage jobs, it's very easy to get stuck at these jobs. Yes, some people who just want to make money, they can do 2 shifts, they can do 2 jobs, maybe from this agency to the other agency, and you can get stuck in that motion whereby you feel like, oh, you're making some good money, and you do not want now to leave that to start either go back to school or start another career. And then you may realize that other jobs may not pay as well as you are paid in these jobs. So I know it's quite easy. If you're not careful, if you have goals of advancing, you should keep your focus on your goals. You should be very smart with your strategy, because it's very easy to get stuck and find that, oh yes, it's 10 years, 20 years, you thought you would do something else, but you have been stuck doing the same job. Maybe you didn't progress. You didn't simply because you had to make changes financially, shifts. The moment you know that you can work your own shifts, then it gets a little hard when now you have to go and do something that has a set time that you have to work. The other thing I must tell you is that there's a little bit of liability. So you are dealing with mostly either you're working with the elderly or people with disabilities. You may be working with people who have mental health challenges. So when you're dealing with that kind of a demographic, it can wear you down. Yes, so it can drain the caregivers. So it's always good that you take care of yourself. And I know some agencies do have wellness support programs for their staff. So it's always good to take care of that, because again, there's something called caregiver burnout. And I know people in this field do experience that. So it's always good to be careful and take care of yourself. Then depending on where you work, you could be on your feet, especially the people who work in homes for the elderly. Some people do tell me that they are on their feet all day. So you're always walking, just like nurses. You could be on your feet for extended hours, and that could cause back pains. So you should just take care of yourself. And those are just some of the disadvantages. But then I think these are rewarding careers. Again, these are not jobs for immigrants only. If you're out there and you're busy mocking your people because they work in group homes or they work in nursing homes, please quit that. These are rewarding careers for real people, not just for immigrants, and they are wonderful. Especially, there are people who are passionate about helping people out, not just a means of getting a wage. There are people who are passionate, and I know a lot of people that I see here, they are totally passionate. It's something that you come here and people feel like, oh, you know what, I'm contributing to something, I'm helping somebody, I'm changing somebody's life, and at that time you're also paying your bills and you're not stressed out. Come on, right? Yeah, so that is, I just wanted to clear up that kind of a stereotype, because I know there's a lot of misinformation. People from back home, they want you to send money to them, and then they're like, oh, you know what, I cannot go abroad to do that kind of a job. These are real jobs, okay? For more videos like this ones and more, keep it here. Please subscribe to my channel, and thank you so much for watching. See you at my next video. Bye now.